COVID-19 cases.
Matt Skilton from Angus in Scotland was nervous about sending his daughters back to school. As will be the case across the UK, for 13-year-old Keris there are no more class or year bubbles and fewer COVID rules.
The fact that they're not vaccinated and actually a number of the population still aren't vaccinated is a real concern. And having looked at how things are happening elsewhere, even with high vaccination, etc. in the population, things opening up, being a little bit more relaxed, really concerned, and the effects of things like long COVID.
Scotland's COVID cases have doubled in a week, and when you drill down into the data, you can see a major reason why. Cases amongst young people 19 and under decreased during the summer break. But here you can see just how quickly they spiked again once schools went back.
The government is very reluctant to reimpose restrictions. I'm hoping things will settle down. The more vaccines we can deliver, the more difference they will make. But it's a tricky situation in Scotland at the moment.
I think it's important to test so that you can protect your friends and your family.
This isn't the news the Department for Education wanted. Their major new campaign is about encouraging parents to feel safe in sending their kids back to the classroom. But in their latest report, the government's own scientific advisors predict a surge in cases. SAGE forecasts exponential increases in COVID cases once all schools are back, with a high prevalence by the end of September, for which they say it would be sensible for government to plan for. Now you might be thinking, why does this all matter? After all, we've had a mass vaccination programme. The majority of vulnerable people are all double dosed. But a new study has shown that the Delta variant, which is now the most prominent in the UK, is more than twice as likely to result in severe illness than previous variants. So there's the public health impact, but also the general impact of more missed schooling if children are catching COVID, as well as the consequences for their parents or carers. Vaccine experts are now taking a cautious but considerable look at COVID vaccines for all 12 to 15-year-olds, with NHS England possibly timing a rollout for the reopening of schools. Some ask why not earlier, why not everywhere? In lieu of vaccinations, scientists say regular mass testing will be key to keep schools open and keep communities safe. Katerina Vittozzi, Sky News.